Okay, everyone, we're going to go ahead and get started. Hello and good afternoon. I hope everybody's having a wonderful Wednesday. I know here it's a little chilly, but it can't get much better than what it is outside right now. So I really do appreciate everyone taking their time out of their schedule to join us for part one of our ACA week. So we are super excited to have our guest with us today, Jared Wasley. He is with Oscar Health. This is the first time that we've been able to present with Oscar. So we're super excited to have them and excited about the opportunity of our partnership together. For those of you that don't know who Oscar is, I think this is going to be a great webinar for you because they're not new to the business, but they are here. They are here to stay, and they are expanding. So we definitely want to partner with them and show them our appreciation and welcome them with open arms. As most of us know, having one carrier in a state really kills pretty much all momentum as far as ACA opportunities. So the more that we have available, the better off things are going to be. More options for clients, better commissions for us. It's just a win-win all around. So again, we are super excited to have Oscar here. Also, I see we have Jocelyn Castillo here too. She is also with Oscar Health as well. So again, we're bringing you the best in the business so that you can hear it from their mouth. I know everybody's been wondering who's Oscar, where are they going to be, where are they expanding, what is it about them that separates them. So that's what I'm going to let them go over with here shortly. But before I turn it over to them, I want to make sure that you guys are aware of just a few things that are located right on our website, messerfinancial.com. Our first actual meeting for our ACA series was last week, Wednesday. I did an introduction to ACA webinar, which we had a great turnout for and response. But if for whatever reason you guys missed it, or you want to go back and you want to watch it again, or just whatever it is for any webinar that is for whatever we do, you can always go back and watch them on our website here at messerfinancial.com. Right under Agent Resources, just about everything you need, guys, is going to be under Agent Resources. There's a tab under here that says Messer Learning Center. Okay, when I click on this, it's going to take me to the webinars that we just previously did. Okay, so if you notice in the last 90 days, here's the introduction to ACA that I was referring to. We have National General, all kinds of different webinars, and each day this week we're going to have a different ACA carrier. So Oscar's going to start us off. They're going to give us some great information, and we're going to continue that momentum each day, presenting a different carrier in different markets. Also, if you ever want to see what's coming up, if you go to our homepage, here's our little calendar, and every one of these that's highlighted here or darkened, that's going to be a webinar. So as you can see, the 21st, Oscar and you, okay, it gives you some highlights, and this is where you can register. Also, if you ever need to know how to do things for the ACA or FFM certification, there's usually something always here. Here's your FFM certification. If you want to know how to do that, which, just by the way, for those of you that don't know, anybody that wants to participate in the ACA this year must complete their FFM certification. It is completely free of charge. It's just one test that satisfies the mandate for all carriers, and it doesn't take long at all. And if you want to know how to do it, all you have to do is just click on this, and it'll take you to all the information that you need. Okay, so new agents, if you're brand new or you didn't certify last year, you would click right here. Returning agents, click here. Pretty much everything that you need to know is here at your disposal. Also, we do have a support team, an agent support department that's specifically here to answer any kind of questions that you might have. You can reach them anytime, Monday through Friday, by calling this number here, and you can just ask for that department, sales support. You can ask for the marketing department, contracting department, commissions department, whatever it is. We have a specific department to help you guys with whatever it is that you need. Because after all, if you're having to do all the admin work, then that's preventing you from doing what you do best, and that's selling, right? So we don't want to take any time away. I know we don't get paid hourly, but at the end of the day, it does come down to an hourly rate. And if you're doing stuff that's outside of what's making you money, then we're not doing our job here at Messer Financial. Also, I would highly advise, guys, that whoever you do partner with, that it's someone that you trust, that it's someone that you think is going to do what's in your best interest and help you grow your business. Because at the end of the day, there is a value to having a partner like an FMO, like a Messer Financial. If you're out there by yourself, it can be pretty daunting having all these carriers, all these different opportunities, and not really having one place where you can go for reliable information. So that's another thing that we're here for. Please use us as much or as little as you want to. We are here to help. One last thing I'll show you. If you haven't done so, I would highly recommend making sure to catch up on our MyMFG enrollment platform. Does both Medicare Advantage and ACA quote and enroll. Definitely something to use. It's completely free of charge to those that partner with us. And just to see, if you want to see what it looks like, here's all of our different quote tools. You hit help quote, it'll take you right to where you need to be for the ACA. It'll go right into the questions. Very easy to use. This year, guys, I believe is going to be the biggest opportunity that the ACA has had since probably 2015, right before all the carriers pulled out. There's so much expansion, so much opportunity. First year commission every year, everyone. And for those of you that do other lines of business, you know how important that is. First year commission every year with these ACA carriers. So if you think that it's not worth your time before, it certainly is now, and you'll definitely want to add them to your portfolio. So again, and you should see on your screen, there is a place on there for questions. You're more than welcome to ask any questions that you want. We will have time at the very end to go through those one by one and stay for as long as you need us. But in the meantime, we're going to go ahead and jump right into that. So Jared, I'm going to turn this over to you. Jared, you are all set.
Great stuff. Thank you so much, Micah. Good afternoon. I really appreciate you spending time with us this afternoon, hearing more about, we'll be a little bit more Asheville or sort of North Carolina specific, but we'll touch base also on our national portfolio a little bit for this upcoming OE for the under 65 ACA business. We had a really successful open enrollment in 2020. We're really excited to continue that success into this year's open enrollment. I'll be presenting myself. My name is Jared Wassley. I also have my colleague Jocelyn as well. She helps out on some of the North Florida market, so she'll also be very well equipped to answer any questions perhaps at the end that you might have for those folks covering some other markets. Let's take a look at our agenda, shall we? We have a introduction to Oscar. We realize that many of you, perhaps this might be your first time doing business with us. For some of you, this might be, your third or fourth year. So in that case, it'll be somewhat of a refresher. And then we'll go into the Oscar difference, member experience, how we're able to deliver, and then kind of an overview of our 2021 product updates, plan designs, and some ideas of our network. And then finally, just how to work with us, some tools that we've adapted for the brokers out there and at large. So let's kind of go into a brief history or introduction of Oscar. Well, firstly, Oscar is the first truly consumer-oriented health insurer, really designed to make health insurance simple and easy for everyday consumers. We'll dive into a little bit more detail about how we're able to accomplish this a little later in the presentation. But in essence, it all started with a bill. Really, it did. Both of our founders had very similar and complicated experiences. One of their wives had a newborn, the other had a simple fracture, and a few years later, you'll recognize this document, they received their bill or their exclamation of benefits, and they were totally lost. If you've ever seen a newborn delivery bill, then you know how convoluted it really can be. And this kind of piqued their interest. They thought, well, there really has to be an easier way to do all of this, to have, a slightly more member-friendly experience. And it's really from this that Oscar was born. So since our launch in the New York individual market in 2014, we first captured around 15,000 lives in that market. You'll see from 2018 to 2020, we more than doubled our footprint year over year. And we finished our 2020 open enrollment with over 420,000 members, and that's between 3 lines of coverage. We have obviously the individual and family-based products, but we also do small group and Medicare Advantage in some other markets too. A call out here for myself, for example, in 2018, we even launched a joint venture with Cleveland Clinic in Ohio, and that's also proved to be one of our flagship products. And then more recently, we just signed a reinsurance deal with Berkshire Hathaway, and that was actually their largest investment into the healthcare industry with that investment, or rather that insurance arm of Warren Buffett's company. And we really are not done there yet. We'll be in a total of 19 states, up from 15 last year. That's now 45 markets or cities that we'll be available in, and that's again 3 lines of coverage. We will be grossing over $2 billion in annual revenue, and we're ramping up as well on the employee side with over 1,400. For example, when I first joined Oscar, we had about 800 employees, and we're now starting to look closer and closer to a 2,000 employee company. Speaking about membership, growth, gross premiums, and all those kind of metric-based aspects, that's all well and good, but if I can direct you to the graph on the far right-hand side, that's our MLR. And what we almost most proud about is scaling not just quickly, but really efficiently, having dropped our MLR from 94% in 2017 to the mid-80s in 2020. And this is really what gets our investors and partners excited. Our models demonstrated long-term success, but most importantly, sustainability, not going into markets, exiting markets. We really are there to build sustainably. One of the ways we're able to do this is really by building trust. We have an NPS score, that's a net promoter score that member satisfaction and trust. And we have a score of 39 compared to an industry average in the health insurance space of -19. That's something we're really, really proud of, considering that 0 NPS is considered a neutral opinion of a brand. We also developed our own in-house claim adjudication software, so partners generally really enjoy working with us. Almost 97% of our claims have no human intervention whatsoever, but really this allows us to pay out providers well, much faster than competitors. It makes us easy to do business, and that in turn allows us to expand our hospital footprint quite rapidly into these new states, and that's part of the reason of our success into new markets. Finally, we're a privately owned company, privately funded, but we've had some really key institutional investors since our inception. One of our largest is Alphabet, the parent company of Google. They've invested over $500 million into Oscar since 2012. We also have Fidelity Investments as well, Goldman Sachs, and 2012 to date, we've raised over $1.5 billion. So going into that Oscar difference that I touched on earlier on, the difference really stems from our member experience and what we're able to provide. And in short, our vision is to make healthcare accessible and affordable for all. But we don't just talk about that, we actually implement ways in which our members can do that. Basically, it's our approach to healthcare. And it's really a 3-pronged approach. Firstly, we believe that ease of use, so making healthcare easy to navigate, creates record levels of member engagement where they're engaging actively with their health, with their insurer. And this engagement ultimately leads to greater out-of-pocket cost decreases and much long-term cost savings to our members. One of the direct ways in which we've actually been able to do this is our introduction of Oscar Care. Now, this might differ market to market, but in general, this contains 2 key things. So first is virtual urgent care. So we've really been speaking about urgent care a lot. I'm sure other carriers have too, but this is something that we've actually built in-house. It's unlimited, 24/7, available on all plans. We've also introduced $0 tier 1 prescriptions when ordered through an Oscar virtual urgent care doctor. And finally, members get paired with a care team, and that's a team of care guides and nurses offering services in both English and Spanish. Let's go into these 2 features in a little bit more detail, shall we? Firstly, the care team. So we believe it's important to, of course, integrate technology into our products, have it user-friendly, have the user experience really seamless. But we also understand the importance of having the human element involved with healthcare. That's where this member care team comes into play. This isn't a generic 1800 service number. Each member gets their own dedicated care team specific to their geographic area. This team is located in our hub in Tempe, Arizona, and they usually consist of 4 care guides and 1 registered nurse. So the care guides there are ready to answer day-to-day questions such as, can you help me find a doctor? What is my copay for this? Do I require a prior auth for this service? And then the nurse is there to ask, of course, more clinical-based questions. So let's say a member has been issued a new prescription. They want further insight on potential adverse effects, or even perhaps some medical advice. That care team nurse is there to help them with that. So for a little bit more insight into how this team is oriented, let's watch a brief video that will show you kind of the motivations behind how this team is organized.
I always say this is a human being on the other end of the line.
One of the things that Oscar is really doing is they're trying to be more hands-on with their patients.
Creating these concierge teams, it makes that whole member experience really worthwhile, and it sets Oscar apart from other industries.
Each care guide is specifically dedicated to their members in that panel.
And then we have an on-site nurse dedicated to them as well.
Several times a day, when I call people, I hear, I didn't even know that this was a thing. And it's kind of nice to be able to tell them, yeah, I'm here, I'm your nurse, so you'll be assigned to me and I'll get to talk to you and you'll reach me really easily.
What you're doing is actually creating a relationship from scratch through phone and messaging.
Just like you would text a friend, you're texting your concierge team.
You're introduced to the person before they go to the hospital. You get to know them while they're in the hospital. You stay in contact with them. You get to help them get back to their baseline. It's really like the full circle of healthcare.
Sometimes when you call into a typical health insurance company, they have an idea of resolving your situation within the first phone call. At Oscar, that is not our standard. It's our standard to make sure we're really listening to the situation the member's going through and to guide them to the best solution that they can have.
When you ask a question about what is my deductible, if we answer that question by telling you, this is your deductible, we answer the wrong question. Because the real question you're asking is, what do I do next?
So answering questions, taking the time, and not just being a number and rushing a person off the phone.
It's not a, okay, here's a call, let me answer it and then hang up type of job.
Once I started at Oscar, I was able to see the value in changing healthcare from the inside out.
The importance of what I do manifests itself differently every day.
What we do is a big deal, and we do change people's lives.
The most rewarding part of my job is getting a message in my email that says, thank you for helping me, or thank you for all you do.
So there you heard it from them yourselves. You see exactly the whole mantra of that team is really service-oriented, helping solution-based answers to members' questions as well. So, and then finally, that second prong of that Oscar Care, we referenced it before, but members have access to the $0 copay 24/7 virtual urgent care benefit. This can be used nationwide and for an unlimited amount of times. And unlike some of our competitors, we did not outsource this feature through a third party. We actually contracted with partner providers to act as our virtual urgent care features, or our virtual care physicians rather. And because of this, we were able to embed this feature on the Oscar app and through the member portal as well, where members can really access their care just a few clicks away. This ease of accessibility, us doing it internally as well, not through a third party, is really the reason why our utilization is 7 times higher than our competitors and industry averages. And what good is having such a fantastic feature as your own telemedicine when members aren't even going to use it? And I touched on it earlier as well. For the first time, virtual urgent care physicians can give members a $0 tier 1 prescriptions when they go through that doctor on call physician. So we are so excited about this enhancement. We're excited for existing markets, but for new markets too. And it's just a real way in which we're able to allow our members to save money and keep their out-of-pocket costs down from day one with Oscar. All of this, I've mentioned the app, but a lot of these features are also available on the website too. And it's really just about making it easy for members to find quality care that meets their needs, helping them stay in network And on average, our members save over $300 a year by using this online search tool, where they can use it to find facilities, the drug search as well, instead of having to go through a formulary. And they can even search certain providers by the ability to book online, distance, gender, language, and other kind of preferences too. So as another addition, I'll just quickly actually go over and do a real-time demo on my Oscar app. So this is my own PHI. I don't mind sharing it. There's nothing that interesting here. So so this is what you see when you open up the app. So we'll show just 3 key features. The first thing is I'll just show, for example, on a member's profile, you can very quickly access just the most basic of information. So firstly, I don't particularly like to have to worry about whether or not my ID card is on me. And I also want instant access to it as soon as I pay my premium. So here I have my Oscar ID card on me at all times. So that's a really fantastic option. Members are also able to go through their claims, medications if they can't remember what they have been taken when they go to another doctor, and even lab results when ordered through Quest will come through the app. Again, that concierge or that care team, you're able to directly message them from your phone. You can call them from there too as well, just depending on how time sensitive the matter is. And finally, let's take us through a scenario on the telemedicine, on this virtual urgent care. So case in point, it's, and this is a real life scenario, this is New Year's Eve. It's just late enough where everything is closed, and I start developing kind of a sore throat, and it feels like it's going to get worse. So let's say I say sore throat. That's the initial kind of symptom that I feel. I'm in New York. Then you can select message if it's not urgent, you just want to ask a question, or a phone call. They'll call you back in 15 to 20 minutes. And let's say there's redness and pain, just to describe. You can go into far more detail as well. Finally, you take a photo. I'm going to avoid that today, but you'd usually take the photo to, if it was a rash or something that you needed a visual confirmation of. So we'll skip that for today. A really fantastic option is now I confirm my number, but I also select the pharmacy that I prefer to pick at. So for me, I'm currently in Brooklyn, and I really like the CVS down the road. I know they're 24 hours, they're easy to get to. I'm going to select that pharmacy. And finally, I'll request the call. After I hit that request call, I get that call back in 15 to 20 minutes. And within an hour, I have that prescription at that CVS, at my pharmacy of choice, without having gone to an urgent care or a doctor, and a lot of the time usually being prescribed a tier 1A or tier 1B drug as well. So massive cost saving, all of that done within an hour. You have your drugs in this particular case for myself. So that's the the product demo app, and happy to discuss any questions you might have on that at the end as well. So let's dive into a little bit more on the sort of meat and potatoes of this upcoming open enrollment. We'll take a look at some plan designs and networks. I did mention this, touching mostly on Asheville, but I'll give, Micah did ask for me to give a slightly more national orientation for this presentation too. We can't disclose everything at this point, but we want to make sure you walk out of here with some good information, knowing where to focus on, and we'll also address any kind of questions you might have market specific at the end of the presentation too. So firstly, we are expanding into the Asheville area. We will disclose the counties officially probably in the next 2 to 3 weeks. But working with a really great hospital system down there, this kind of gives you an idea of the extent around Asheville that we're able to work in. But that's kind of all I can show for now. But we really do think that we can make quite a difference in this area. There hasn't been, as Micah said, a massive amount of competition year to date, but we believe we can make a mark in this market. So. First off, our products are all non-gated. They usually use an EPO-based type product, so members gain sort of unrestricted access to the full network that we offer. And we are expanding. So this gives you a good idea as to our expansion efforts and sort of 2020 to 2021 changes. So in blue, you see all our existing states. So 15 states at the moment. That's changing to 19. So we added Iowa, Oklahoma, North Carolina, as an expansion, and then we're expanding within some of the states. So I know for example, myself in Ohio, we expanding the Cleveland market, Columbus as well, Phoenix, we're growing there too, and then as Jocelyn can probably speak to further as well, some additions in North Florida as well. So really a strong year for us upcoming, and we're really excited about the further opportunity that you will have to have Oscar in your market. And we also utilize some of the highest quality national partners to build a complete patient experience. So would be remiss of me not to mention this. So CVS Caremark is our pharmacy benefit manager. That's of course Target, Walmart pharmacies, thousands of mom and pops throughout each state. Quest Diagnostics is our preferred lab partner. Those labs will actually sync with the app as well. Optum manages our mental health benefits, and of course, being ACA plans, they include pediatric, dental, and vision. So Liberty and Davis takes care of those aspects for us. And finally, Quorum provides our home infusion services. So in Asheville for next year, fairly straightforward plan design. We have 13 plans across 3 metal tiers. So that's bronze, silver, gold, and of course, included sort of as part of bronze is a catastrophic plan for those members 30 or under. That's a non-gated network, no PCP assignment even required, and members will never need a referral to see an in-network specialist. Last year, in fact, we introduced a $3 prescription drug list available from day one. So this is a pretty unique aspect. It's a $3 tier 1A drug list, really there to help minimize prescription costs for your clients. And then we've gone a step further, where this year we've also introduced that $0 tier 1A and tier 1B prescriptions available for no charge or for $0 when ordered through that virtual care provider. And as I may have mentioned earlier, all these plans include Oscar Care. So that's the free unlimited virtual urgent care, that care team, a step tracking rewards where members get money for hitting their step goals in the app, and of course that app access as well. So I'll just touch on 3 plans that we believe that will be pretty competitive. This is specific again to Asheville, but we think these might be quite strong in a number of areas. So firstly is our Oscar Silver Saver 2 CSR 200 plan. So this is a really simply structured co-pay silver plan for those members who receive subsidies. This particular one, 200 FPL, so that's around $52,000 for a family of 4. And this is ready for members who require tier 1 and tier 2 RX as an upfront benefit, but still want a low deductible with affordable copays on most basic coverage. So you see there, a deductible is very low at $970, and then fairly low primary and specialist care, urgent care, and then again, they have that $3 prescription list when going through kind of the normal sort of physician avenue. Let me see why I am not loading that. Sorry about that. That should be fine now. Okay, so and then finally, I actually failed to touch on it. So this year as well, we reintroducing HSA plans. We'll actually have 2 on offer in Asheville and also in a number of markets too. So I've highlighted here the silver HSA plan. So of course, it's fantastic for folks who need an HSA, but they still want a low deductible silver option. And then if they're expecting to hit their deductible, really having affordable copays after that deductible is met. And that's for those clients looking to save money on premiums and of course on the taxes through the HSA, and especially those wanting lower deductible options, should medical care ever be needed, or for those folks who are expecting to meet this lower deductible and then reach those affordable copays going forward. And finally, the Oscar Classic Bronze Next Plan. So this is something that we introduced last year. It's a $0 deductible, but with bronze tier pricing. So it's almost like a mid to high tiered silver plan, no deductible, only a deductible on the prescription side. So straight off from January 1st, members have $35 primary care visits, $100 specialist copays, urgent cares at $75, and prescription drugs at $3. And this is, again, a great alternative to some of those high deductible co-insurance plans that are so popular on some of the lower rungs of the bronze tier or even the silver tier. We believe this is a fantastic plan. It was very successful last year. It's great for subsidized on-exchange clients who don't necessarily qualify for CSR plans. So like that first plan I showed, perhaps they're just above that level. So they're not really getting the cost sharing on the copay side, but they still are getting somewhat of a deductible. And then really members who are still price sensitive, but prefer to have this upfront medical copays as opposed to a lot of co-insurance after meeting deductibles. And of course, for folks who want medical care, but perhaps don't need to take something above a tier 2 prescription drug. So finally, how to work with us. So we'll go through a little bit on our tooling and a couple of things that we've added and adjusted from last year, or even just great tools that we're looking forward to bringing out. So first, I highly recommend all brokers bookmark hioscar.com/brokers. This is really your one-stop shop for all broker resources. So you will find your plan grids, the rating grids will become available. There's marketing collateral, the network information to print out for your clients, and then even that provider and prescription drug search tool that I mentioned too, incredibly useful resources. Through your appointment, you get access to the Oscar Broker Portal, and this really allows you to quote and enroll on and off exchange clients. You can view and print temporary member ID cards. That's always a great aspect, especially for some of those folks who are really eager to get their hands on their ID cards. You can also track your commissions payment, and we even allow you to track member engagement. So if someone, for example, hasn't created a web account or downloaded the app, knowing how much sort of cost savings they can earn, you can kind of send them an email from yourself through the portal as a sort of reminder to engage with your client in that way. Through this tool, you're able to enroll both on and off exchange. When you enroll off exchange, it's really straightforward. It'll kind of seamlessly go through and usually be in our system in 1 to 2 hours, so really easy experience there. When it's on exchange, you'll enter in some preliminary information, and then there'll be sort of a double redirect where you go to the exchange to finalize any of the enrollment information. This is more applicable for some of the existing brokers or existing states. We've submitted our renewals that you can do that online now as well. There's no manual process no more, and you're able to do this really seamlessly, and any folks renewing lives will have this experience where you can see the auto map plans, you can see other plan options for your members too. And finally, something that we're really happy about is it's a second year improvement on this, where we introduced it last year. It's now even more comprehensive, but we've introduced our improved payment feature. So this includes a billing and payment center for each individual client. And basically, when you click into your client on your book of business, you can see the full billing and payments history of that. And you can even make a binder payment on behalf of the client. So making sure that members become active once you have their information. We know that that was a great value added last year, and we've made that process even easier to do this year. And finally, I mentioned that team based in Tempe, Arizona, the care team. We also have a broker support team. So we understand that you and your broker partners don't work typical 9 to 5s, and neither does this broker support team. They're available 8 a.m. to 8 p.m. and they're really able to assist with general education, commission escalations, enrollment support, and you can also email them as well for any non-time sensitive aspects. finally, we believe that we are here to win your trust and really earn your business. So we have the help when you need it. We have that broker support team, as well as the market contacts like myself, like Jocelyn, various other colleagues around the country who are really there to help. We kind of really do a fantastic job of serving the broker community. Also, ease of doing business, this online enrollment appointment process, managing the book of business, helping you engage with your clients. And because we own the whole stack of the broker technology that we've built it all in-house, we're really able to adapt and change it as we get feedback from the market. And finally, we won't touch on this so much today, but we believe that we offer very competitive compensation and generally having flat structures for new and renewing business in most markets, not all, but most of our markets, we believe that it's important to have flat new and renewing business here. Finally, Oscar Broker Welcome Kits. If you do attend one of our sort of state-specific Oscar webinars, you will get a survey after that. If you do, please do fill it out. We want to hear your feedback, but we'll also send you this really neat broker welcome kit with all sorts of Oscar swag, branded swag that you or your members and clients can use. And finally, that is basically it. I've spoken a lot this afternoon. I thank you so much for your time. We'll wait for questions to come in, and then we'll do our best to answer them. Thank you so much.
Wow, Jared, that was a lot of great information. I would say, at the very least, your company seems to be quite innovative. I know that for a fact that people who have never seen Oscar before have ever seen plans that are structured like that. A $0 deductible bronze plan. That is something like who's heard of that before, unless you're in Florida last year, right? That seems to be something that's completely different concept. The way you guys are just doing business, the way that you can have your clients use your technology 7 times more to get the answers that they need to make it easier for them. After all, at the end of the day, some of these plans are so bare bones because that's all people can afford. And what good is insurance if you can never use it for anything? You guys have made it to where you can go on a day-to-day basis and use your technology to not only help them when they're sick, but also help them stay healthy. And I think that really is the future of insurance, something that's constantly evolving. And again, just to have something like that as another option to what's been out there, or just to be able to see things in a different way is just huge. So I'm super impressed. I'm sure everyone else out there that was listening was pretty blown away with what you were showing as well. There was a few questions. One of them was, does your care team, do they help with billing issues?
Yes, I should have mentioned that. Sorry. And Micah, you should do some of my broker pitches. I really like what you said about us there, so thank you. It's all about the member at the end of the day, and yes, that care team is there for claims-specific issues as well. So claims, general questions, but yeah, they are in direct kind of contact with the claims team, and they will be the go-to for any kind of issues that are claim related.
Here's another one. I know you can't be too specific, but maybe if you could maybe just give a little ballpark figure or a roundabout. I'm not sure what all you can. And guys, we will keep you up to date as more information comes available, but obviously we want to make sure everybody has a head start and has at least an idea of who you do need to partner and who you want to partner with for this OEP. And also keep in mind too, there's no production requirement. So for those of you that maybe don't primarily focus on the ACA, but you want to have them as an option, they are free to get appointed with. There's no production requirements, and we know one thing: with more options, once people find out that there are more options out there, that they're going to want to know what they are. So make sure that you have this product. Make sure that you know these things so that you can sound intelligent when you're dealing with clients out there. But in the Georgia market, because that is such a highly populated and aggressive market, is there an idea of some places of where you're going to be? Northern, middle, lower, maybe a little bit of all of it?
In terms of pricing?
As terms of where you're going, your footprint, your area.
Oh, there. So I can actually disclose that. So if you give me
Okay.
1 second, I'll actually pull that up. I try to have as much prepared as possible, but of course, someone always asks something that I can't completely remember. So we are in Georgia. We expanded there last year, in fact. Um, and I believe we will probably have a very similar outlook from last year. Like you said, it is incredibly competitive. We work with Wellstar in that market, um, and we aren't expanding there, but we are in Butts, Clayton, Cobb, Douglas, Fulton, Troup, Spalding County. So we really are kind of the greater sort of MSA Atlanta area, and a touch south of that, and that's all around the Wellstar system.
Great. Let's see. Here's another question. Can your out-of-state footprint be used by our Asheville members? So, for example, if you're traveling to New York City, let's say, but you live in Asheville, can you use a local Oscar provider and be billed as in-network?
That's a great question. So, as is common on most exchange plans and not small group plans, you won't be able to do that. However, what you will be able to do is you will have access to that telemedicine feature. So if it's anything non sort of life-threatening, you'd be able to use that dock on call feature anywhere in the country.
Do you have any idea when the 2021 plans will be available online?
They usually go live on 11/1, so that's a lot of the times in most states, brokers will have an inkling on 11/1.
And I'll tell you also, just from my past experience, check healthcare.gov because really that's the best way to be able to compare anything. I mean, unfortunately, we won't know exact rates or anything until right before it opens. And sometimes healthcare.gov will give us like a week or so before then. So keep an eye on that for any additional information. Let's see. How can we find out about the state-specific trainings?
So yeah, I'm glad you asked. So state-specific trainings, if you go to that hioscar.com/brokers or even on our website, you'll see a link for brokers on the top, and you just select event registration. When you get to that, all of the state-specific training will be available. So for example, for myself, I have 9 different markets. I'll be on 9 of those, and my colleagues around the country will be doing their specific ones. So a lot of very similar information, but there we will disclose much more in regard to county-specific, hospital-specific type information.
Let's see. I think of this one you've already answered. Does the bronze plan have a brand drug coverage?
It does not have a brand drug coverage. So basically, how it's oriented is I'll actually pull it up for you. So this is just going to be, I'll just do North Carolina just for simplicity's sake. So for example, you have tier 1 A and B. So tier 1A is of course that $3 list. It then goes to $30 for 1B, and then tier 2 is 30, and then brand names, which is usually your sort of tier 3 and up, it's going to be a post deductible. So you have a prescription drug list that's a prescription deductible that's 5,500. So this plan, to be honest, is largely not for folks who are taking branded drugs, unless it's one of the branded insulins or something of that nature that's on that $3 list. This is probably for folks who you know for sure can take a tier 1A or tier 1B drug.
What states are you doing Medicare in? Because we do have a lot of Medicare Advantage agents on here.
Yeah, for sure. So we launched Medicare Advantage last year in Houston. So that will continue for next year, as well as New York. So that was the Bronx and an area called the Lower Hudson Valley, just kind of north of Westchester County. And then next year we will be in Broward County for Florida.
Great. And let's see. A lot of these are very county specific, but obviously we don't know yet. Let's see. In Florida, will we still have the out-of-network urgent care visits covered for members traveling out of Florida and or out of the service area?
I can't speak specifically to Florida. I'm not sure if Jocelyn is able to mention that if she's still on the line.
Hi everyone. So can you repeat your question one more time, Mike? I'm so sorry.
No, that's fine. Yeah, it says in Florida, will we still have the out-of-network urgent care visits covered for members traveling out of Florida and or out of the service area?
Yeah, absolutely. So for example, like if a family has a son or a daughter, in college in Orlando, they're actually able to use our network, in and out our network in Orlando, all our services area, especially in the new 10 new counties that we just expanded in Florida.
Terrific. Where do you see an area where you'll have a stronger network than maybe other areas in Florida?
I would say all of our networks right now are definitely improving. A lot of the agents have submitted over, doctors that they're currently working with, and we're accepting that. I would say right now our strongest network is definitely Broward and Orlando.
Okay, well that basically looks like all the questions. Again, I want to thank both of you and everybody that's on the call now for taking the time out. Also wanted to mention that Messer Financial, one of the biggest reasons why people are so excited too is for the advances. No other agency or FMO is doing that. We are advancing commissions and we are paying bonuses. So if you have all of your ACA appointments with us, or you're looking to do an advance on your commissions and actually get paid before Christmas for business that you wrote between November 1st and November 30th, we can do that for you. So a lot of really exciting things going on right now. We would love to earn your business. We want to partner with you. We love the partnership that we have with Oscar. I see great things coming. And Jared, Jocelyn, did you have anything that you wanted to say before we sign off?
Jocelyn, anything from your end?
Well, all I will say is I'm very excited. If you're, coming from a Florida's perspective, we are very, very excited for the additional services that we've added this coming OAP, and we're just, we're thrilled. I think that this year is going to be a lot of opportunity for all of our agents in all the areas that we're going to be in Florida. And of course, if they need anything at all, they can always just send us an email. Thank you.
I think that's everything from us, Micah. Thank you so much to you, all your agents, and then perhaps we can do this again. Maybe Jocelyn and I and you can sync. Be happy to perhaps do a more nationally orientated one where we're able to disclose much more about those states that you're concerned with, and go into further detail. So happy to spend more time with the folks on the line and you as well.
Absolutely. We will keep everyone up to date with the information as it becomes available. So again, thank you everyone. I hope you have a great day and stay safe out there. Thank you.